Hi, I am Malti Dubey, Assistant Professor, Department of Chemistry, Government Autonomous Girls PG College, Sagar, with interesting and learning episode of B.Pharma on the important units CVS agents, which are the very important unit of this section of medicinal chemistry for 6th semester, which is prepared by me. Let's start our episode while taking a look at what we are going to learn today. Module 1st, Introduction of CVS agents. Module 2nd, Cardiac Glycosides, SAR, Mechanism of Action, Toxic Effects. Module 3rd, Antihypertensive Agents, Introduction, Etiology, Ganglion Blocking Agents. Module 4, Antiadrenergic Agents, Drugs acting directly on smooth muscles, Drugs acting in CNS, Propranolol. Module 1st, Introduction of CVS agents. Let's start with introduction about CVS agents. Introduction. Cardiovascular agents are those drugs which have direct action on the heart or other parts of the vascular system, and they modify the total output of the heart or the distribution of blood certain parts of the circulatory system. Cardiovascular disease (CVD) is a leading cause of global mortality, accounting for almost 17 million deaths annually. A great advance in the prevention of CVD has resulted from the identification of measurable factors that predict the development of CVD. These factors are termed risk factors. Several risk factors are direct causes of CVD. These are termed major risk factors and include tobacco smoking, high blood pressure, high serum, LDL, cholesterol, and elevated glucose. A final major risk factor is advanced age classification. Now we will take classification. Cardiovascular drugs are classified as follows: cardiotonic drugs or cardiac glycoside. Second, vasodilators. Third, antihypertensive. Fourth, antihypercholesterolemic drugs. Fifth, sclerosing drugs. Sixth, antiarrhythmic drugs. Besides these, there are other classes of drugs which do not necessarily have a direct effect on the cardiovascular system, but are of considerable value in the treatment of cardiac disease. These include the diuretics and the anticoagulants. Cardiotonic drugs or cardiac glycosides. Introduction, structure, some important drugs, factors, usage, SAR, mechanism of action, toxic effects. First we will take introduction. These are naturally occurring drugs which are known to occur in certain plants and in toad venom. These have direct action in the heart and are used for the treatment of congestive heart failure and certain cardiac arrhythmic condition. The mechanism of cardiotonic drugs, therapeutic and toxic action are still not completely known. So far, the most historically and commercially important sources of cardiac steroids are two species of Digitalis D. purpurea and D. lanata. Structure. Cardiac glycosides are generally found in nature as the corresponding 3-beta glycosides. 1 to 4 sugars are added to the steroid 3-beta hydroxyl to form the glycoside structure. The glycone portion is usually substituted at position 17 by a 5-membered unsaturated lactone ring. The sugar moiety is generally substituted in position C3. The structures of some of the glycosides are as follows. Some important drugs. Some drugs belonging to the class are digoxin, digitoxin, purpurea glycosides A, purpurea glycosides B, digitoxin, lantoside, uaben, etc. Positive entropic digitalis substituents are amrinone, dobutamine, mibronone and theophylline. Some of these are discussed here. First, digitoxin. It is obtained from digitalis purpurea and digitalis lanata. It is a glycoside of digitoxygenin. It is highly lipid soluble and is absorbed in the gastrointestinal tract. It has a long duration of action. It would be preferred with patients with potentially variable renal function. It is increased the tone of cardiac muscles. It is assessed by spectrophotometrical methods. Digitoxin. It is a digitalis lanata glycoside of digoxygenin. Because of its moderately fast onset of action and relatively short half-life, it has become the most frequently prescribed digitalis steroid. It may be given orally, intravenously or intramuscularly. Uaben. It is a glycoside obtained from the seeds of Strophanthus gratus. Its glycon is uabegenin. It is too poorly and unreliable absorbed to be used orally, but its extremely fast onset of action makes it useful for rapid digitalization in emergencies. Generally, the digitalis increases the contractility of the heart muscle. It increases the force as also the velocity of myocardial contraction, but shortens the duration of systoles. It promotes more complete emptying of the ventricular and decreases the size of heart in the case of heart failure. It also influences its electrophysical properties such as conductivity, refractory period, and automaticity. The effectiveness of the digitalis is treatment of congestive heart failures is mainly because of its positive entropic effect, whose mechanism may involve one or more of the following factors. Now we will take factors. First, it may influence the movement of sodium and potassium ion across the heart muscle membrane, thereby resulting in the loss of cell potassium. Second, it may have direct action on the contractile proteins of heart muscle. Third, it may have increased the available intracellular calcium by releasing it from binding sites. In spite of poisonous nature of digitalis and their low therapeutic index, the digitalis are still regarded as the choice drug in the treatment of congestive heart failure. Uses. The most important use of the cardiac glycoside is in the treatment of heart failure, consequently causes reduced heart, decreased edema and decreased heart size. Mechanism of action. Now we will discuss about the mechanism of the action. Cardiac glycosides exert positive entropic effect on heart. At the cellular level, digitalis inhibits membrane-bound sodium-potassium activated adenosine triphosphate. This inhibition increases intracellular sodium. This sodium in turn exchanges with extracellular calcium, thus increasing intracellular calcium levels, inhibition of the enzyme. Also, this is outward pumping of the both sodium. The net effect is an increase the calcium pool available for excitation. Contraction coupling, toxicity. All cardiac glycosides have the potential to cause toxicity, as the minimum toxic dose of the glycoside is only 2 to 3 times the therapeutic dose. Intoxication is quite common. In mild to moderate toxicity, the general symptoms are nausea, vomiting, anorexia, bronchitis, muscular weakness, and ventricular premature contractions. In severe toxicity, common symptoms are vision, diarrhea, AV block, ventricular tachycardia, and disorientation. The toxicity of cardiac glycoside is due to the inhibition of the sodium-potassium ATPase pump, which results in increasing intracellular levels of calcium. The high level of calcium are responsible for the observed cardiac arrhythmias. Now let's start module 3, antihypertensive agent. Antihypertensive agents further divided in the following parts. First, introduction. Second, etiology. Third, ganglion blocking agents. Fourth, drug acting directly on smooth muscles. Fifth, drug acting in CNS propranolol. Now we will take first, introduction. An agent that reduces high blood pressure or contract high blood pressure. Hypertension or high blood pressure is the name of pathological condition in blood pressure is persistently elevated. The blood pressure is a measurement of the pressure of the blood against the blood vessel walls. The persistent high blood pressure puts undue stress on the heart, blood vessels, and other organs. It is single contributing factor and responsible for producing a number of cardiovascular disease (CVD), which causes morbidity and premature deaths. The primary causes for this ailment may be environmental, such as smoking, obesity, diabetes, hyperglycemia, continuous stress and strain, sudden shock, unachieved ambition, etc. Recently, the genetic discovery reveals that human hypertension is caused by mutations in WNK kinases proteins. Regarding the clinical control over this ailment, it is conventionally treated with diuretics along with beta blockers or vasodilation as the first line of management. The treatment may be further extended with a combination beta blockers and other types of antihypertensive agents like alpha blockers, ACE inhibitors, and calcium channel blockers in the cases of severe to malignant hypertension. An ideal antihypertensive drug should produce a reduction in the blood pressure through generalized vasodilation without side effects or development of tolerance during continuous administration. The antihypertensive agents to be considered in this article include the Rauwolfia alkaloids, the Veratrum alkaloids, and a group of synthetic compounds. I will discuss these one by one. For A, Rauwolfia alkaloids. The alkaloids have been used in the treatment of mild hypertension. Sometimes they are combined with other hypotensive agents. In case of severe hypotension, when those alkaloids are used for the treatment of hypertension for a long time, their side effects are unpleasant types of drowsiness. B. Veratrum alkaloids. Various alkaloids, protoveratrins A and B, craftonamines, and alkevervir is isolated from the roots and the rhizomes of Veratrum album, also bring about a fall of blood pressure. They have been found to be more potent when given orally. Synthetic antihypertensive agent. Among synthetic hypertensive agents, some important ones are as follows: hydralazine, It is an orally vasodilator that reduces peripheral resistance by direct relaxation of arterial smooth muscle. B. Minoxidil. It is useful in the treatment of severe hypertension resulting from increased vascular resistance. It is given in combination with propranolol and hydrochlorothiazide. C. Diazoxide. It is direct acting vasodilator which relaxes smooth muscles. D. Prazosin. It is an orally effective antihypertensive agent for treating mild to moderate hypertension. When used alone for severe hypertension, methylodopa. Methylodopa is mainly used for the treatment of moderate hypertension. F. Clonidine. Clonidine hydrochloride is used for treating moderate to severe hypertension, lower blood pressure by central action. Now we will define about the etiology. In the etiology, further divided in following parts: A. Definition, B. Classification, C. Factor. In this topic, you are going to learn about what etiology means and how etiology is broken down into three main categories. You will also go over a concrete example to demonstrate the etiology disease. Etiology is the study of origination or causation. The word derived from the Greek kritoigia means giving a reason for. First, definition. The term refers to the causes of disease or pathologies, the science dealing with causes of disease and their mode of operation compared to pathogenesis. The science of causality in common uses, the cause itself. The term etiology and pathogenesis are closely related to the question of why and how a certain disease or disorder develops. Models of etiology and pathogenesis therefore try to account for the process that initiate etiology and maintain pathogenesis a certain disorder disease. As part of the etiology of a respective disease, only causes that directly initiate. Second, classification. A disease etiology or cause generally falls into three categories: A. Intrinsic, B. Extrinsic, and C. Idiopathic. A. Intrinsic. First we will take about intrinsic etiology. Intrinsic means coming from within, therefore any pathological or disease causing change that has occurred from inside the body has occurred as a result of intrinsic factors. Example: inherited conditions or conditions that are passed down to you from your parents. An example of this is hemophilia, a disorder that leads to excessive bleeding. Second, metabolic and endocrine or hormone disorder. These are abnormalities in the chemical signaling and interaction in the body. For example, diabetes is an endocrine disease that causes high blood sugar. Third, neoplastic disorders or cancer, where the cells of the body grow out of control. Problem with immunity, such as allergies, which are an overreaction of the immune system. B. Extrinsic. The second category of disease etiology is extrinsic etiology. This means the cause of the disease or pathological change come from outside of the body. The following are examples of extrinsic factors. First, infection agents like bacteria, viruses, fungi and parasites. Second, animal bites or stings. Third, chemicals, electricity and radiation. Fourth, iatrogenic causes. This is just a fancy way of saying that the problem resulted from a medicinal professional's action or within a medical setting. C. Idiopathic. The third and final category of disease etiology is idiopathic or unknown cause. Remember, we are idio, it's for not knowing the disease etiology. 3. Factors. In medicine, etiology refers to the many factors coming together to cause an illness. It is normally the focus of epidemiological studies. Etiology, consisting of two Greek terms for origin and study of, refers to the study of the causes of a mental or physiological disease. As part of the etiology of a respective disease, only causes that directly initiate the disease process are considered as etiology factors. Etiology factors can thus be considered as necessary conditions for the development of disease. The etiology of certain condition is mostly defined not only by one, but rather by the interplay of many different conditions, such as biological, environmental, etc. So, the study of all factors that involve in the development of disease, including the susceptibility of the patient, the nature of disease agent, and the way in which the patient's body is involved by the agents. Ganglion blocking agents. Ganglion blocking agents now further divided into these following parts: A. Introduction, B. Examples, C. Uses. First we will take introduction. A ganglion blocker is a type of medication that inhibits transmission between preganglionic and postganglionic neurons in the autonomic neurons system, often by acting as a nicotinic receptor antagonist. Nicotinic acetylcholine receptors are found on skeletal muscle, but also within the route of transmission for the parasympathetic and sympathetic nervous system, which together comprise the atomic neurons system. More specifically, nicotinic receptors presynaptic to the postsynaptic cells. Thus, for example, blocking nicotinic acetylcholine receptors blocks both sympathetic and parasympathetic stimulation of the heart. The nicotinic antagonist hexamethomycin, for example, does this by blocking the transmission of outgoing signals across the acetonomic ganglia at the postsynaptic nicotinic acetylcholine receptor. Because ganglionic blockers block both the parasympathetic nervous system, the effect of these drugs depends upon the dominant tone in the organ system. Second example. The first ganglion blocker to be used clinically was tetraethyl ammonium, although it was soon suppressed by better drugs. Nicotinic receptor antagonist. First, hexamethonium. Second, pentolenium. Third, mecamylamine. Fourth, trimetaphane. Fifth, tuvocurarine. Sixth, pempidine. 7. Benzohexanium. 8. chlorosandamine. 9. pentamine. 10. nicotine. Third, uses. Ganglion blockers are used less frequently now than they were in the past because antihypertensive with fewer side effects are now available. Hexamethonium has been described as the first effect antihypertensive drug. They are still used in some emergency situations such as aortic dissector or autonomic dysectalexia. Side effect. First, cardiovascular, orthostatic, postural, hypotension, tachycardia. Second, GIT drug mouth. GIT, autonomy, urine retention, digestive problem. Third, sexual disinfection, failure or erection and ejaculation. Let's start module 4, antiadrenergic agents. This chapter includes definition and classification. Those compounds that decrease or block the effects of sympathetic nerve stimulation, endogenous catecholamines and antiadrenergic drugs. Definition: antiadrenergic agents inhibit release of norepinephrine in brain, decrease effects of sympathetic nervous system stimulation, leads to decreased blood pressure, blocking transmission of impulses from the adrenergic, sympathetic, postganglionic fibers to affect or organs or tissue, inhibiting such sympathetic function as smooth muscle contraction and glandular secretion. An agent that produces such an effect called also antiadrenergic agents. Classification: antiadrenergic agents are of following types. Class: genetic name, brand name. First, alpha and beta blockers. Second, centrally acting agents. Third, peripheral nerve acting agents. First, adrenergic blocking agents. These are the drugs which by virtue of completion have been found to inhibit the action of catecholamines and other adrenergic agonists on their specific receptors. They have been found to be effective against catecholamine that has been released from sympathetic nerve endings. The net effect is blocking of impulses which are being transmitted by the adrenergic nervous system. These are of two types. First, alpha adrenergic blocking agents. Second, beta adrenergic blocking agents. This reveals the presence of two types of receptors in tissue having both types of receptors, such as blood vessels. Alpha stimulation causes contraction, whereas beta causes relaxation. Adrenergic blocking agents, these drugs in such a tissue will cause vasodilation. In organs having only beta receptors, example in the heart, the beta blocking have been bound to oppose the excitatory effect of norepinephrine, which is released from nerve endings. Beta adrenergic blocking agents. These have been discovered recently. The first compound discovered was dichloroisoproterenol, which has been found to be acting exclusively as a blocking agent at the beta receptor. However, it is not found to be clinically very useful. Another compound, propranolol, was introduced which is effective in the following indications. First, angina pectoris. Second, cardiac arrhythmias. Third, hypertrophic subaortic stenosis. And fourth, phenochromocystoma. It, however, slows anterioventricular conduction, promotes bronchoconstriction, lowers plasma renin actively and may cause hypoglycemia. Centrally acting agents inhibit the stimulation of the CNS, central nervous system, and decrease sympathetic stimulation, the blood vessels and the heart. They block the release and action of catecholamines, epinephrine, norepinephrine, dopamine, which are released in response to stress. Centrally acting antiadrenergic agents make the heartbeat slower and with less force and relax blood vessel. All these actions leads to a decreased blood pressure. Centrally acting antiadrenergic agents are used to treat hypertension. Peripherally acting, a drug may be classified by the chemical type of the active ingredient or by the way it is used to treat a particular condition. Each drug can be classified into one or more drug classes. Clinically, these agents are used to treat asthma, nasal congestion, heart block, and hypertension. Some sympathogenic agents are used for their central stimulant effects and for their anorectic action. Most of these drugs, adrenergic stimulants, contain an intact or partially substituted amino group. Chemically, these can be grouped as under. First, adrenaline, epinephrine and related compounds. Second, ephedrine and related compounds. Third, aliphatic amines. Fourth, imidazolone derivative. First drug consists of catecholamines and these drugs are non-catecholamines. Drug acting directly on smooth muscles. A. Introduction. The interpretation of the results of pharmacological experiments on smooth muscles has difficult because of lack of precise knowledge of three factors. A. The morphology and physiology of smooth muscle cells and their innervations. B. The mechanism of uptake, synthesis, storage, release and inactivate of transmitters from autonomic nerves. C. The mode of action of drugs on the smooth muscles cell membrane. The progress that has been made during the past few years in interpreting the effect of drugs on smooth muscles has largely been achieved through investigations of these factors. However, in general, the results have only served to emphasize the complexity of the problem and the inadequacy of many of the earlier explanations. B. Smooth muscle. Smooth muscle is an involuntary non-stand muscle. It is divided to subgroups. The single unit and multi-unit smooth muscle. Within single unit cells, the whole bundle or sheet contracts as a syncytium multi-unit. Smooth muscle tissue innervate individual cells as such. They allow for fine, central and gradual responses. Smooth muscles is found within the walls of blood vessels, arteries, arterioles and veins, male and female reproductive tracts, gastrointestinal tract, respiratory tract, the ciliary muscles and iris of eye. C. Therapeutic uses of anti-adrenergic drugs on smooth muscles. First, bronchodilators, treatment of asthma and bronchitis agents that stimulate beta-2 adrenergic receptors of bronchial smooth muscle, causing relaxation. Example, albuterol, ephedrine, epinephrine, isoethérine, isoproterenol, terbutaline. These agents may also affect uterine and vascular smooth muscle. Ophthalmic topical. Application to the eye surface affects the vasculature of the eye, stimulating beta receptor on small arterioles, thus relieving conjunctival congestion. Example, phenylphrine, tetrahydrozoline, epinephrine, naproxen, vasoactive. Sympathomimetics, also called cardioselective sympathomimetics, used to support the heart cardiac failure or shock. Example, dopamine, ephedrine, epinephrine, phenylphrine. Drug acting in CNS. Propranolol. These drugs block the sympathetic nervous system in the genesis of some cardiac arrhythmias. In normal therapeutic conditions, the blocking effects of these drugs show the following anesthetic effects. First, they depress adrenergically enhanced phase. 4. Depolarization through beta receptor blockade. Next, these drugs decrease neurological induced automatically at normal therapeutic doses. Next, at higher doses, these drugs cause excitability. Next, reduced velocity of conduction. Next, prolonged effective refractory period. The example of this class is propranolol. Propranolol is a beta-adrenergic receptor blocker. It is useful in the treatment of supraventricular arrhythmias, arterial fibrillation, atrial flutter, proximal supraventricular tachycardia, and digitalis. Induced ventricular arrhythmias. The fruitful results are obtained when propranolol is used in combination with other drugs. Example, propranolol with quinidine shows better results in elevating arrival fibrillation than either drug alone with propranolol therapy. Few serious adverse side effects have been seen. Propranolol is a drug which helps anxious patients troubled by these symptoms by cutting the vicious cycle and gives symptomatic relief. Propranolol does not affect psychological symptoms such as worry, fear, and tension. Propranolol suppresses anxiety in short-term successful situations, but this is due to peripheral rather than a specific central action. Long-term use of relatively high dose of propranolol changes in subtle behavior, forgetfulness, and dreaming with nightmares. Gastrointestinal upset, lack of drive, and hallucination are common side effects of propranolol. It is well absorbed after oral administration. It is quite soluble in lipids and can easily penetrate in brain. Conclusion. With all this information, here we comes to end of today's lecture. Cardiovascular agents have direct action on the heart or other parts of the vascular system. Understanding about different drugs of cardiovascular system as well as the medicinal chemistry aspects of various cardiovascular drugs helps to optimize therapy to meet patients' specific needs. Do keep in mind what we discussed today. Time for your self-study. Thank you, thank you, thank you.